didn't know Zoom could do this. This is really cool.
Yeah, I'm playing around with something for, as we grow the monthly giving program. I want to do something like this each quarter. But, we've got about 20 monthly donors right now, so we need a few more. Here comes Bill. Welcome, Bill.
The privilege of being a chiropractor is to exist in the world as one with great power in our members. We are agents of change in the lives of our patients to bring about a swift reckoning to their suffering. We are beacons of light to guide others on a path of well-being, restoring good health to millions without making a single incision. What a privilege to carry the means of healing with us wherever we go. For all we really ever need to do the work is our hands and our wits.
Welcome everybody. I'm so excited. I've watched that trailer probably 50 times now, and still love to see it every time. It's so cool to kind of get a glimpse behind what's going on in Botswana, and we're so grateful to Jane for making it possible. I want to welcome everybody to this chat with the filmmaker. Hi, Jane.
Hi.
Thanks so much for joining us today. I first heard from you probably almost 2 years ago. What led to you reaching out, and give us a little bit of your backstory?
Yeah, so I ran my own business as a videographer for many years, and commercial video work is so different from charity and storytelling and documentary. And I think, like many people coming out of COVID, I kind of had this kind of moment where I was thinking, why am I delaying telling the stories that I want to tell? And so I compiled a list of charities, and I told myself I'd give myself a couple months to just go and travel and volunteer and help incredible organizations tell their story. And World Spine Care was one of them. And when I read up all that you guys were doing, I saw a little part on scoliosis, and that really hit close to home for me, because when I was 13, I was diagnosed with scoliosis and pretty much grew up at BC Children's Hospital. The medical team there were amazing and really watched me grow up ever since I was a kid. And, I always tell people that for me, because my curvature wasn't, it was big enough to require surgery later in life, but it wasn't super noticeable from the outside. And so I called it an invisible condition because nobody really knew that I had it. And, when you're a teenager and you're growing up, you don't realize how isolating it is to go through something and not have anyone to share your struggles with, and not have your peers go through something similar. And so when I saw the scoliosis support group, it was very healing for me, because it was something that I would have loved to have growing up in Canada with the best healthcare. And so I really, that's what really inspired me to go and tell the story.
I love that that's the thing that stood out to you most, because it's probably one of the things that, even I wasn't really totally familiar with how it started and what an impact it was making. So I'm really glad that that's part of the story that really stood out to you, and that you've highlighted really well in the film. That was one of my favorite parts of the film. It was just, it's so great to see that. I'm curious if you could share a little more about your adventures. You didn't just go to Botswana, you also went down under to Australia and around there. Tell us a little more about the other organizations you worked with and the films you did there.
Yeah, so I went to New Zealand and I was in Wellington and I helped a charity called Nature School New Zealand. And so they kind of offer an alternative form of education. And it was really amazing because, you see these young little girls who know how to build a campfire, cook food by it, build up tents and everything. And just the confidence building and the independence that these kids gain by knowing that they can do so much on their own was really empowering. I think the thing that I love about filmmaking is every story stays with me, and everything that I get to see, people learn. It gives me knowledge in itself, and so these little kids are so amazing, but they still stayed with me to this day. And then from New Zealand, I went to Vanuatu, which is a tiny Pacific island nation 4 or 5 hours north of Sydney. And I helped an organization called Sister Vanuatu, which is an organization run by women for women, and it helps women flee domestic violence and find a safe space where they have support and women who will give them strength when they might not feel they have it. And I was there for a march for an end to domestic violence, which is really prominent in the Pacific Islands. And it's incredible to see the community come out and support them and see the work that they were doing, not just on individual levels, but through policy and changes in government and starting a conversation of, it starts with how we raise our boys and how we change the narrative. And so I thought that was really incredible and just in paradise. And by day 3, I was part of the community. I highly recommend going to the Pacific Island nations. And then I made my way over to Botswana, which was just like a childhood dream of mine ever since I was a kid.
Yeah. And tell us about that experience, going to Botswana and hanging out with the clinicians and meeting Scott and Joan.
Yes. Oh, Scott and Joan were amazing. It was, as Michael and Mufudzi will tell you, getting there was quite a journey for me. I lost my camera bag in the process.
Oh, I didn't hear that.
Yeah, so
Oh my gosh.
they lost the most important thing, which was my camera batteries and my drones. So I learned to always have an air tag. And so I was so stressed out and I felt really bad for Michael and Mufudzi because it's my first time meeting them. And I just kind of arrived all frazzled and stressed out after like a 24-hour journey. But luckily the bag came. And so I remember driving with Mufudzi, and the first thing I noticed was the sunset. And I just said, of all the places in the world that I've been to, I've never seen a sunset like this. And he was like, oh, wow, like I never would have, when it's something you see every day, you don't really think that it stands out. And so for anyone that's watched the film, you'll see that I chose one of the scenes at sunset. And that was a really big part for me because I wanted people to see the beauty of Botswana that was so lucky to see.
Yeah, I think you're talking about the part with Michael and Cabello. Yeah, that cinematically, that's one of the most beautiful shots in the film, and I just love that. And also such a great discussion between Michael and Cabello. Wow, I did not know that you lost your camera for a while as you're going to record a film. Like that's
Moment of panic.
Oh my gosh. Oh, well, I'm glad you got it back. That's so cool. Anything else stand out to you about kind of the learning about the clinics and other projects that were going on? Again, I haven't been able to go to Botswana, and your film taught me some things that were going on. So I'm curious what else you learned about the projects while you're there.
Yeah, I think I really saw the beauty of Botswana and the great sense of community. In Canada, like I was very lucky to know my surgeon and my nurse really well, but that's just because I grew up with them and saw them like twice every year, but the relationships that I saw built with the medical community and how respected and how loved both Michael and Mufudzi are in both of their in the hospital and in the clinic. I don't know, that I think that was what really kind of stayed with me. I remember every morning in the Mahalape hospital, they have the morning meetings, and they're like, "Oh yeah, can Jane come up and speak?" And I was like, "What?" Like, I'm not important. Like, I'm just here to do a small project. But they cared and they wanted to get to know me and they wanted to get to know what we were doing, and that level of like care and interest and just having each of his backs was really, really kind of unique to see. And seeing the relationships that like Mufudzi has built at the BHC clinic, it was really cool. Yeah, I was just really taken away by how impactful the work was, but also how meaningful the relationships that were built, both with the teams that they worked with and the patients as well.
Yeah, that's great.
It's a very personal experience.
Yeah. Thanks, Jane. I will have a chance to ask a few more questions, but I do want to bring up some of the clinicians and hear their perspective of being on kind of the other side. So if we can chat with Mufudzi real quick. Welcome, Mufudzi. Thanks for joining us. I know it's getting late for you.
Yeah, no, this is fine. Thanks, Nathan. So great to be here.
Yeah. Well, can you tell me a little more about your kind of your side of the story and why it was important to you to share the background of the BH3 clinic and your friendship with Shannon in particular, which is highlighted in the film?
Yeah, thanks, Nathan. So I think like I shared in the film, Shannon was a volunteer that I met in 2018 when I first came to Botswana. And so Botswana's I think everyone has a different experience when they come here, when they move here. Like I'm from the country just next door, but it was also still an exploration, even just for me, coming to a different space. And I think the fact that we got to explore Botswana at the same time. So we stayed together in the house in Mahalape, Botswana house in Mahalape, and just like discovering simple things like, where to buy, to get your phone, to be able to kind of get airtime on your phone, to be able to make phone calls, figuring out like all the cool spots to kind of hang out, like to see great sunsets in the city, in the village, sorry. And just figuring out life, like in Botswana. So the people you get to do that with, those are memories like you become core memories, like, that have become core memories to me. And it's kind of the magic of the World's Bank experience, in the sense that you get to, immerse yourself in a culture that's different from your own, and find people that are also like deeply passionate about helping other people in such a practical way. So, in the sense that Shannon and I got to experience that together, and then veering from that, that's almost like the seed of things. And, as things tragically turned out, just a year later, it just felt like such an important story. And I'm really, truly grateful that Jane came to Botswana when she did, to like capture this, beautiful story that's, basically coming out of, a family's kind of tragedy, like bringing something so beautiful to help so many other people, for people that, I'm trying not to give spoilers for people that maybe haven't watched the film yet. So I just feel so privileged to be able to kind of be in this moment, like to experience things in real time as they've happened, and then having other people to kind of see that happen. Yeah. So I'm still kind of, I don't really, when you're in a moment, like almost like how Jane was describing sunsets now, like sometimes you don't see the beauty until someone like takes a great picture of it, like, hey, did you see this? So that's kind of what this film feels like. It feels like, we're here all the time, and we, it's amazing. But sometimes you appreciate certain things even more when someone comes and shines a light and shares the story. So yeah,
and does it so well.
I think that's
it makes you look so good. Makes you look so good on film. What more can you share about the involvement of the Block family and the BH3 clinic, kind of how projects have progressed?
Sure, yeah. So the Block family has basically been the biggest, one of the biggest reasons why this clinic, Broadest 3 clinic, is in existence right now. So a year after Shannon passed, Shannon's dad, David Block, reached out to me and was basically just trying to get a sense of, is there any way that they could support an effort in Botswana, because this was something that was so dear to Shannon, particularly because it was, like I've said, she had come to Botswana just a year before she passed, and they wanted to kind of continue her legacy in some kind of way. And I was trying to also I was also in a space of trying to figure out what I wanted to still do in Botswana, and I'd moved to the city, the capital city now in Gaborone. And basically, they set up a foundation to basically fund up the project in Botswana, the BH3 clinic. And just looking back at the timing of things, we had just kind of come out of the first year of the pandemic. It was 2021, and there's so many different factors that kind of came in together, and we were able to establish the clinic right at the beginning. And we're actually coming on almost 4 years next March, which is
that's right.
Crazy to think about. Yeah.
Well, that's amazing. I mean, again, even for me being so remote, but also being involved in the work, it's kind of helpful to see the different perspective that Jane brought to that story. Yeah. The other thing I'd love to hear more from you is the title of the film, which I'm so glad this was the title of the film, the word Tshidilo, which has quite significant meaning. Can you explain a little more about that?
Yeah. So my first time hearing or noticing this word was when I think it was in Cashion Clinic, and I was hearing a patient describe on the phone where she is. So sometimes patients say things like, I'm at the clinic, or I'm at the physio, or I'm at the, but no one actually says the word, like, for example, most of us are chiropractors, but they would just typically say something like physio. But there's another word that was used, and it wasn't specifically to a profession. It was just to describe the experience of what they're receiving at the clinics. And they used the word Tshidilo. And I remember asking Kabelo at the time, what does that word mean? And, and it's interesting because in Setswana, the same word can be used to describe multiple different things. At the, we've done a little bit of research on this. And basically, the word Tshidilo means to physically anoint the sick, right? It's historically been used in the country as in Botswana as a means of alleviating the suffering of an individual, primarily through physical touch. However, it can also be used for emotional healing. So the words for, if someone was to go to see a counselor, a psychologist, a pastor, anyone to help them through mental, emotional kind of challenges, that same word would be used. So in a sense, it's not just the physical kind of touch. It's also literally the words, direct translation from Setswana into English are to physically, to massage the emotions, right?
Interesting,
And so there's this idea of be able to provide therapy, to rehabilitate, to restore. The same word again is used when you're describing rehabilitation. In different contexts. For example, if someone is being in a process of rehabilitation, let's say, for example, through a recovery program, So there's so much kind of additional meaning that the word Tshidilo has, as society has kind of included more things. So, for example, like as professions such as psychology and physiotherapy and chiropractic now have kind of been introduced into the society, the word Tshidilo kind of covers a lot of things. So it just feels like such a simple and powerful way to summarize a lot of what we actually do in Botswana. And it's actually the words that patients use to describe the care that they're receiving at World Spine Clinic. So there has this kind of, ideally this physical, emotional, mental kind of care that can be received at our clinics. Yeah.
Yeah, that's amazing. I love that it encompasses all the different things because World Spine Care does try to incorporate all these different things in the work that we do. So I'd love to invite Michael up to tell us a little bit more about the Tshidilo that's being provided in Mahalape and with the Yoga Project. So welcome, Michael. Thanks for joining us.
Hi, guys.
So kind of the film takes you, and as Scott and Joan are visiting, and you're walking through this new clinic space, and then very into the film, we get to hear that you're there now, right? You were able to move in. What has that new clinic space been like for the past couple months since you've been there?
Yeah, so we moved on the 13th of September. We finally moved into the new Moko clinic, and it's been amazing. We now, I mean, you'll kind of you don't really get to see the space that well in the movie, but we have a vitals and screening room, we have an exercise room, and then we have 2 treatment rooms and a big kind of open area where we do yoga, and our own entrance and reception. And yeah, it's just been going really well. We also have a new clinician who joined recently, Dr. Patrick Boylan. And the clinic really just allows us to work a lot more efficiently. So having an exercise room just dedicated to the exercises means you kind of saving 5 to 10 minutes after each treatment, where before, when we had limited space, you'd see the patients and then you'd show them the exercises, you get them to do it, then the patient would get changed, then you start the paperwork, and now we kind of finish the treatment, the patient gets changed, and I walk with the patient out to Kabelo. I say, we want to do these 3 exercises, and then I can take the next patient file and start immediately with the next patient. And you kind of save 5 to 10 minutes, and the patient benefits because they get one-on-one exercises with someone who's speaking their language, who can communicate,
right,
who is the lead yoga instructor, who's doing the exercises with everyone every Monday. So that's been like the biggest change. And then just the clinic being more centrally located. So the hospital, the district hospital where we were, is kind of on the outskirts of town, and it is a referral hospital. So typically patients would go to their local clinic and then get referred to the hospital. But now our current location, it's kind of in the center of town. It's a lot closer to the bus rank, to the shops and all of that. So it's a lot easier for patients to come directly to us. And we try to emphasize that you don't need a referral. We want to be first contact, primary spine care. So it's more being in this clinic is more convenient for us as clinicians and our efficiency, and for the patients to actually access their care.
That's amazing. Yeah. What other things do these clinical assistants, Kabelo and Uncle Betsy down in Gaborone, what are their other functions, and how do they help with running the clinic?
So they are trained as medical auxiliaries. That's a 1-year course, kind of similar to a nurse, but a shorter degree, and where they can basically work in any department. So Cabello worked in OPD. He was doing ECGs during COVID, and then came back to spine care. So at World Spine Care, he does a lot of the paperwork with the patients. So he'll collect the vitals, run through the kind of review of systems. And this is great because patients often, even if their English is great, they don't want to communicate medical things in English because they feel like something might get lost in translation.
Right.
So it's great that Cabello can really, get into it in Setswana. So the main thing is kind of booking, phone calls, review of systems, all the paperwork, and then Cabello has done the training, the World Spine Care training for yoga. So he's our lead yoga instructor. We have yoga sessions every Monday morning from 8 o'clock to 9 o'clock. And at this point, I just let him run with it. Some days the patients will come in for treatment afterwards, and they'll be complaining a little bit, and Cabello will be like, "Yeah, we went hard today. Like we emphasized this, or we did more spinal stuff." So he's really made it his own, and the patients really love it. It's quite interesting how we can see the patients that are really involved in the yoga programs seem to be doing better. It's almost like they've taken the responsibility of their back pain on themselves. So they're not looking to get better from the doctor, but they understand that they have to give input themselves. If they're not doing the exercises, if they're not stretching, if they're not watching their form, they made the connection that they're going to be painful the next day.
I love that. Yeah. So they're learning some self-management, not becoming reliant.
Exactly.
Yeah, that's great. And I still love one of the papers that World Spine Care published years ago in Botswana. I think it's called Botloko, something like that. But it highlights the challenge of the language and how not just the translation, but the way they describe things. I think it describes, the sensation of what we would call radiculopathy or sciatica as ants crawling up and down the leg. So if anyone hasn't read that, it's just such a cool paper to read and to hear the difference of how we use language. I think Patrick was telling me one of the things he noticed is that patients will talk about hearing their pain. Is that right? Is that something you've come across?
Yeah. So they'll, if we talk, let's say we're talking about radiculopathy, let's say they can hear the pain going down their leg. Mm-hmm. Or like instead of a burning type of pain, they would, the word for burning and for explosion is similar. So they'd say it feels like an explosion in my back, which is
that's so interesting.
So we there's always this balance between trying to get to the point. As a clinician, you're aware of time. You don't want to spend 2 hours, on every patient. But then also like you kind of want to dig in and be like, I understand what they're saying, but what words are they using to describe it? I don't just want to know, is the pain going down the leg? I want to know what expressive words are they using to describe the sensation that they perceive as pain or burning or ants crawling under their skin or cramping. That's and awesome. Honestly, I'm not someone who is really interested in learning many other languages, but like doing this type of work has like inspired me to want to learn Setswana better, learn Sepedi next year, or learn Zulu again. Like I learned when I was a kid, but now I'm interested again. So it's funny how working in this context has all these other kind of effects on your life.
That's awesome. Jane, were there any words that you picked up while you were there that you still remember?
I'm gonna be really bad at this, but I tried to be really good with the greetings at the end. So like, dumela, ma, dumela, ora. I'm really bad at that. My problem is with the accents. But okay, Michael and Mufudzi, you're gonna have to help me with the bread that the radical lady would bring me in the morning.
Ooh.
Bread cake?
No, it was like a deep fried bread, kind of like a donut.
Dipapata? Maguinya?
Maguinya.
Maguinya. That
Okay.
was such because my mom makes similar bread and donuts that kind of are the same, and so for her to bring that kind of felt like a little piece of home. But yeah,
Nice.
I slowly was getting there.
Oh, that's lovely. Yeah, I really hope I can get down to Botswana sometime soon. I've been to South Africa, because my wife is South African, but haven't been able to make it up a little bit further north. Well, guys, this has been so cool. This has been so great to hear from you and learn a bit more about the behind the scenes. Jane, what are you working on now? You came home, you got a job with another organization. Tell us a little bit about that, and then any other projects you have coming up.
Yeah, I was really lucky to get a job with the BC Professional Firefighters Burn Firemen Association. So now I'm a filmmaker for firefighters and do go in a fire truck and film them doing really amazing work. And you know, like again, what I loved about this film was there's so much to tell that, you know, people who've been a part of the organization for so long probably didn't really fully know everything. And I think that's the power of storytelling. And so now I get to do that for firefighters, and people think it's just fires, but it's so much more. It's advocacy, it's cancer awareness. And so, yeah, I am kind of transitioning to hopefully do film journalism on the front lines of disasters. That's my goal. And so hopefully I get to, go when disaster strikes and be a part of the team that tells the story of first responders and vulnerable communities that have been affected.
Yeah, very exciting. Yeah, and as you mentioned, there's so much to tell. Our initial conversations were about doing like a 5-minute film on the clinic in Botswana, and now it turned into, well, it's 25, but that wasn't enough, right? There's still so much more that we could have shared. So, and couldn't have done it without you. Thank you so much. I mean, it was, as I've said, it's like something I've always wanted, but I can't get there, and clinicians are so busy with just seeing patients. So we couldn't have done it without you. We really appreciate it.
Yeah, thank you so much for the opportunity and for making the time for me to come in and put you on the spot and make you play guitars. So, I really appreciate it.
I think we still have Jean and Bill on the call. If you have any questions, or Vince, I think, is still there. You can drop them in the chat, or unmute yourself and let us know if there's anything you want to ask them. Yeah, Bill, go ahead.
Yeah, just curious as to Nathan and Jane, what are we going to do to try to get this video out there? I mean, they got to get the story told out there in the various communities, to the public too. I know you've probably thought about that, Nathan, but what do you think?
My role is mostly online, and so I'm getting it, as much as I can on all of our channels online and sharing it out there. We're talking about, reaching out to the chiropractic colleges and having student screenings of the film. Certainly going to be sharing it with the various boards, the provincial boards in Canada, if we can get in touch with state boards in the States. And Mufudzi and Michael, I think, might have some other ideas. I don't know if there's anything you can share or talk about.
Yeah, sure. We're trying to promote this with WFC as well. See what different platforms we can get for sharing it there as well. So I think there's a lot of chiropractors around the world that are not what's fine here in general. And I think this would be a great way to update them on what's happening in our community, and then also letting them know about the new project that, for example, that's happening in DH3, and also the new clinic in Moko Clinic in Mahalaku. So I think there's definitely different spaces such as the WFC, the African Chiropractic Federation as well, that we can share this on. So yeah.
I think one of the things, Bill, is that our biggest difficulty seems to be getting it shown in the United States. And any help that you can give in that direction for state conventions or that type
Well,
of thing?
I have an idea, actually,
Yeah, please.
Nathan. So I'm associated with the Academy of Integrative Health and Medicine, and we have a 32,000 member mailing list, all in the integrative health community. So that's MDs, DOs, and everybody else as well. So we do send out newsy things about, things that are integrative in nature, and especially something like this with World Spine Care, with, what the actual mission is, right? Global, underserved communities sort of thing. So if you want to, you've got my email, I think, Nathan, if you want to send me, let's correspond on how we might be able to get this into our distribution system.
That would be great.
I think I can make that happen.
Yeah.
So
I'd love to do that. Yeah, I was part of, is it still called AHIMA, I think is the initials, right?
AIHM.org is the website.
Right.
So,
yeah, as a student, I was involved with the student association here in Oregon. So that would be a great, great group to share it with. The other thing, early on when Jane and I first chatted, we've talked about submitting this to film festivals. And one that I had in mind was the World Health Organization has been doing what they call the Health for All Film Festival, which is around the world. And I've been quite disappointed because usually they announce that in November and I hadn't seen it yet. But Jane, I did just see on their website they are doing one next year. They're just a bit behind. So we need to figure out, which part of the film, and we can submit it to that. So that'll be very exciting to get it in front of a bunch of people with the World Health Organization.
Very exciting.
That's a really good idea. I mean, we will try in Canada to get it at the Canadian Chiropractic Association and that sort of thing to so that as many people as possible. It's really hard. I'm just listening to the program today, and I just want to congratulate all of you. I think you made amazing presentations. When I was president of CMCC, they used to laugh at me because when we came to do our annual reports, I would say to them, okay, you got to make me cry. And what I meant by that was that they really had to touch me emotionally if it was going to make a difference. And sometimes they did, and many times they didn't. And we used to discuss that. But it's listening to everybody's experience it's very touching. You really begin to understand how you feel about what you're doing, how you feel about about your patients. And I think that is vitally important. This isn't something that we're doing for ourselves. This is something we're doing because of the results we get and because we actually are changing people's lives. And that in itself is a privilege. But changing people's lives in areas where they haven't had the opportunity in many cases to do that before. And I think that's so important. And if we could get that out to more people, I think that would be a huge success for us. So I want to thank all of you because I think you all did an excellent job today. So thank you.
Yeah, wonderful work, wonderful film. Thank you, Jane. Thanks, Mufudzi and Michael, for joining us. And share it around. I mean, it's on YouTube, it's on our website. You can, send it in an email, put it on Facebook, put it on your Instagram, whatever it is, however you can share it with people and send it out to big groups or small groups or anything. And let us know, if there's some specific way that you want to use it. Contact me at info@worldspinecare.org. And again, if you're a student or any association or organization would want to pass out or share the story with your members, we would love to be able to do that. Thanks everyone again for your time today and for sharing your experiences and everything that motivates you to bring spine care to the people who need it most. We really, really appreciate it. So thanks a lot.
Thank you. Thanks for all your work.
Thank you.
Really
Thank you, Nathan,
appreciate
for
that.
this again.
Jane, once again, thank you for a wonderful, wonderful film. Wonderful.
So I'm just so grateful to have played a very small role in this incredible organization. So thank you for welcoming me in.
Not small at all. Huge role. Huge role. Yeah,
Very
we can't thank you
definitely.
enough.
Very definitely.
Yeah. All right. Well, we'll let you all get back to your evenings and your mornings, and I know we're all across time zones. So thank you guys so very much, and we'll keep in touch.
Thanks, everyone.